Hello, my name is Ravi Vij. I'm from My Cancer Haven. And today I have with me Dr. Gurbakhash Kaur, who is assistant professor at UT Southwestern Medical Center in Dallas, Texas. And we're going to talk about a novel therapy that is likely to be approved in the not too distant future here in 2023 in the United States called Talquetamab. So welcome, Gurbakhash.
Thank you, Dr. Vij, for having me.
It's a pleasure to have you here. So for our audience, first of all, I think a lot of them have probably had daratumumab. Some of them may have isatuximab and Implicity. These are monoclonal antibodies. But bispecifics obviously are a new development. We just had the first one, Talquetamab, approved. But what are bispecific antibodies? How do they differ from monoclonal antibodies?
So a monoclonal antibody like Dara or isatuximab or Implicity, they have the ability to only bind to one antigen. So in this case, in the case of daratumumab and isatuximab, they bind to CD38. So only one binding possibility. Whereas a bispecific, what it does is it has the ability to bind to two things. So it can bind to something that's expressed on the myeloma cell, so a tumor antigen. In the case of Talquetamab, that's BCMA. In the case of Talquetamab, it's GPRC5D, and also at the same time can bind to CD3, which is expressed on the T cells. And by binding to both of these things at the same time, it's able to bring the immune system close to the myeloma cell and actually stimulate an immune reaction against the cancer cells.
So that's amazing. Obviously, these are things that we weren't able to do just a few years ago. And as we'll discuss, it seems like these are very promising.
Yes, very much indeed. We're very fortunate in the myeloma world because we have had, several drugs approved in the last decade or so. And every time it's progress. We went from monoclonal antibodies to CAR T cell therapy, which is also utilizing the strength of our immune system, and now to bispecifics, which, they sort of have a similar effect as CAR T, but they're dosed on a weekly or every other week basis, and just it works in slightly different way than a CAR T cell therapy. So as you can see over here, we have SLAMF7, which is we have a drug against that. That's elotuzumab or Implicity. You have CD38, which is a target in myeloma, and we have daratumumab and isatuximab that's been developed, and obviously BCMA, in which we have belantamab mafodotin, which was an antibody drug conjugate, and then CAR T cell therapy such as ide-cel and Carvykti.